All right, a very warm welcome to everyone to today's edition of the regular webinar series, the Planetary Health Dialogues, organized and facilitated by the Center for Planetary Health Policy. We're a Berlin-based think tank working on a nexus on global environmental change and health, and on putting planetary health at the top of the political agenda. My name is Ann-Kathrin von der Haar. I'm working as a research associate at the Center for Planetary Health Policy, and I have the pleasure to guide you through the next 60 minutes together with my colleague Dorothea Baltrux, who I will hand over to.
Test.
Yes, hello from me as well. Dorothea Baltrux, I'm also a research associate at CPHP.
Thanks, Doro. And as the title of today's event suggests, within the next 60 minutes, we want to focus on the pollution crisis, which is, in addition to climate change and biodiversity loss, the third major anthropogenic planetary crisis of our time. And every day, tons of harmful and sometimes persistent chemical substances are released into our soil, into our water, and our air. And at the same time, the chemical industry contributes significantly to exacerbating the other planetary crisis, accounting for 6.3% of global greenhouse gas emissions. And with our event today, which is part 1 of 2, we want to set a starting point, providing an overview on the extent and the diversity of health and environmental impacts of chemical pollution on the national, the European, but also bigger on the global level. And touching particularly on the new global framework on chemicals, which was adopted last year at the ICCM5, which is the International Conference on Chemical Management. And today we want to additionally look on current and future policy priorities for tackling health and environmental effects of chemical pollution. And to do so, I'm very happy. We have invited a fantastic panel, which I will introduce to you in a minute. But first, some final words on today's agenda and housekeeping. A starter, we will be hearing short inputs from our 3 panelists, and subsequently these will be followed by a discussion and that will be moderated by my colleague Dorothea. And as we want to make it as interactive and engaging as possible, we would like to invite you to put your questions and comments into the chat box at any time. And we will try to incorporate your questions and comments into the discussion and conversation as best as we can. And additionally, the panelists can also answer to your questions and comments themselves in the chat. And I would love you to make sure that you're all muted. Otherwise, it's kind of a little noise. And lastly, as a final information, you might have noticed already, this event will be recorded and the video will be made available on the CPHP website and the YouTube channel afterwards. And now I am very delighted to introduce you to our first speaker, Dr. Jutta Emig. She is trained as a food chemist and is working for the German Federal Ministry for the Environment, Nature Conservation and Nuclear Safety already since 1992. Correct me if I'm wrong. And since 2014, she is the head of Division International Chemical Safety and Sustainable Chemistry. And today, Jutta Emig will provide us a short introduction to the new global framework on chemicals and the results of the ICCM5 that took place last year under German presidency. And I look forward to your input and will now give the floor to you, Mrs. Emig, and share your slides.
Thank you very much, Ann-Kathrin, for your kind introduction. Dear ladies and gentlemen, dear colleagues and friends. I'm very pleased to provide you with a short introduction to the new global framework on chemicals. Let us first take a look back into the history of the global chemicals management. In 2002, the Johannesburg Summit on Sustainable Development initiated a process to implement Chapter 19 of the Agenda 21, adopted in Rio 1992. In 2006, the first session of the International Conference Chemicals Management, and I from now on will skip the long name, ICCM1 adopted the strategic approach on international chemicals management, known as SAICM. ICCM was established as the governing body overseeing SAICM. Since 2006, ICCM has met 4 times, with ICCM 5 being the last meeting. The overall objective of SAICM was to achieve the sound management of chemicals throughout their life cycle, so that by 2020 chemicals are used and produced in ways that lead to minimization of significant adverse effects on human health and environment. That's the so-called chemicals goal. In 2015, ICCM4 decided to initiate an intersessional process to develop recommendations regarding the strategic approach and the sound management of chemicals and waste beyond 2020. At that point in time, it was already obvious that the global chemicals goal would not be met. It was confirmed by the Global Chemicals Outlook in 2019. And the Global Chemicals Outlook also states that business as usual is not an option to achieve the goal. In 2017, the first meeting of the intersessional process took place in Stockholm. 3 more meetings, or I should rather say 5 more meetings, a series of informal consultations and an open-ended working group were necessary to prepare the recommendations. And now I come to the global framework. On 30 September 2023, ICCM in Bonn concluded this international negotiation process, which was unique in a way because representatives from governments, from the private sector, non-governmental organizations, intergovernmental organizations, youth and academia participated on equal footing, resulting in the historic decision to establish the global framework on chemicals free for a planet free of harm from chemicals and waste. ICCM also adopted the Bonn Declaration, through which stakeholders committed to prevent exposure to harmful chemicals, phase out most harmful chemicals and inter alia enhance the safe management of chemicals. Finally, a number of resolutions were adopted to provide for implementation arrangements and intersessional work, inter alia on health surveillance systems, gender and chemicals, highly hazardous pesticides, and most important, to establish the GFC Fund. Let's now go into more details, starting with the Bonn Declaration. The Bonn Declaration forms, together with the Global Framework on Chemicals, the fundament of the global chemicals governance. Ministers, heads of delegations, and stakeholder leaders acknowledge that pollution is one of the world's largest risk factors for disease and premature death, with pollution from chemicals contribute to millions of those deaths, illnesses, and disabilities each year. Highlighted the crisis of pollution, climate change, and biodiversity as being closely interrelated, that need to be also addressed in an integrated manner, and emphasized that sound management of chemicals and waste is essential to this end. They committed to, and I can only mention very few of the commitments, protecting human health, strengthening capacity building and financial support, developing and adopting the necessary national chemicals and waste frameworks, strategies, legislation, and action plans, and also enhancing national action to support the implementation. Since the global framework on chemicals is not legally binding, but a voluntary framework, the value of this political declaration cannot be overestimated. It supports awareness raising on the importance of sound management of chemicals and waste across the life cycle, and will hopefully increase political will and commitment. On the 3rd of September at 11 a.m., I can assure you, we were very exhausted after the long and unhealthy hours of negotiation. It felt like we were finally done with our work. Unfortunately, this is not true, not even half the truth. Following up at action at all levels is required. In these days, the UN Environment Assembly meets and is expected to formally endorse the framework and start implementation immediately. Other UN entities, including the UN General Assembly, are envisaged to follow this example. And while we are meeting here, there's also a meeting of the Global Chemicals and Health Network administered by WHO going on debating the implementation of the new framework. Our ministry and the Federal Environment Agency also plan to continue our collaboration with stakeholders from all sectors. And now I would like to move on to the global framework. You will see on the slide the structure of the framework. Of course, we cannot go into each and every detail. I will just focus a little bit on the strategic objective and targets, which are the heart, the core of this new framework. So you can see in the next slide the 5 strategic objectives: legal framework, institutional mechanisms, capacities are in place. By 2030, comprehensive, sufficient knowledge, data, information are generated, available and accessible. Issues of concern are identified and addressed. Safer alternatives and innovative and sustainable solutions are in place, and also enhanced implementation occurs through increased and effective resource mobilization, partnerships, cooperation, capacity building, and integration into all relevant decision-making processes. These 5 strategic objectives are underpinned by 28 targets to guide countries and stakeholders in jointly addressing the life cycle of chemicals, including products and waste. You can see all of them on the following slides. However, due to the lack of time, we cannot go through the targets one by one. I just want to emphasize some of them. From a government perspective, the most important one is A1. By 2020, governments have adopted and are implementing and enforcing legal frameworks. This is of outstanding importance since according to OECD studies, around 100 countries still lack basic chemicals management arrangements. Their targets, or all targets, are relevant to all stakeholders. However, there are some more specific, like A1, A6, A7, B1, B6, B7, C6, and E6 are of particular interest for the health sector. Some of them require the health sector to take the lead on action. I have highlighted the crucial aspects in green, relating it also to the respective SDG. I unfortunately need to leave it with that and like to invite you to visit the website of the framework and would like then to continue with the next steps. As you know, the global framework on chemicals is like its predecessor, a multi-sectoral and multi-stakeholder approach. To achieve the shared vision as well as the objectives and targets, it requires the enhanced involvement and commitment of all sectors and stakeholders at all levels, the local, national, regional, and international levels. Stakeholders are invited to set out their future actions in work plans, roadmaps, milestones, pledges, or other appropriate commitments, which should contain clear definitions of roles and responsibilities and of the intended implementation. The framework recognizes, as I have already mentioned, the critical role and unique expertise of the health sector to contribute to the sound management of chemicals. Stakeholders are encouraged, and you see this on this slide, to use the World Health Organization Chemicals Roadmap as a tool to facilitate cross-sectoral collaboration and to identify concrete actions that the health sector can contribute towards the achievement of the strategic objectives of the framework. This roadmap, the WHO Chemicals Roadmap, is a very best practice example that can be used also for other sectors to explore and develop their own roadmap. In 2026, the first session of the international conference overseeing the global framework is going to meet. Pakistan is holding the presidency. The conference is expected to take stock of progress on the ground and to further develop the framework based on the outcome of intersessional work inter alia on the measurability structure and indicators, and to also work on transitioning the existing emerging policy issues and issues of concern into the new arrangements. The conference will be prepared by an open-ended working group in 2025. And this brings me to the end of my short introduction of the framework. I thank you for your attention. I also look forward to our discussion, and I count on your support with implementation. Thank you very much.
Thank you so much for your input, Mrs. Emig. We will definitely follow up on this topic later in the conversation. And if you have any questions for Mrs. Emig and her input now, please feel free to already use the chat function and raise your questions there. And next, we will continue with our second speaker, and I'm very pleased to introduce Dr. Hussein to you. He studied political science, international relations, and environmental studies, is trained as a journalist, and holds a PhD in urban ecology. And he is the Secretary General of the Environment and Social Development Organization, short ESDO. He is the Executive Vice President of the World Alliance for Mercury-Free Dentistry and co-chair of the Asian Center for Environmental Health. And today, Mr. Hussein will give us a short input from an environmental justice perspective on chemical pollution in general, and also in regard of the new global framework on chemicals that we just got to know. And hereby I forward it to you, Dr. Hussein.
Thank you very much. And I would like to apologize all the participants because I'm still having some cough due to the heavy pollution in Dhaka city. So I'm impacted about the pollution. So maybe sometimes the voice is not be up and down. So I apologize for that. So thanks once again for organizing this event, important event. And my previous speaker emphasis on the global framework on chemicals. This is an important framework. This is a guideline. This is to be deal with the upcoming days. And for the chemical and environment is the issue that we have to address properly. And usually people are saying that chemical is harmful for the environment and human health. This is true, but we have to consider that how much chemical is harmful and how we can deal with this chemical. Everything is chemical, and without chemical, it is difficult to framework of our living things. And if we can consider the synthetic chemicals and the organic chemicals, these are both are toxic in nature, but the issue is that how much chemical can create toxicity. That is the important part, and that creates the havoc for the environment and health. So I would like to articulate my presentation on this. So I hope this is okay. Can you see my slide? Is it okay? Okay.
Yeah.
So I'm discussing on the environmental justice, a view on the chemical pollution. And environmental justice, why environmental justice? Environmental justice is the important and the integral issue of the human justice, the issue of the rights, issue of the all creature. So the framework with the environmental justice is not for the human being, it is for all creature in the nature. So if we can think about that way, that we have to address, okay, slides. Okay. So link between environment and chemical pollution. So if we can, I'm trying to visualize this image and just looked at this image, how it's create our everyday life and what is the environment. And if we can find the environment, it is in our hand. So if we can consider that the process of the pollution by the chemicals and the related to, I'm mentioning earlier that the chemicals, both synthetic and organic, and how we can deal with this. So in the consideration of the environmental justice, the chemical is very much linked with our environment and the human in nature. So the most important things is that the risk distribution, discrimination of the systematic rights, the healthy environment, and if we can consider that this is a huge discrimination of that, if we can see that developed countries and the developing countries, it's a huge gap between the process, between the management, between the production and uses. If we can see that, if you can see that in the city of Bonn, and if you can compare with the city of Dhaka, and if you can measure, right now, the Dhaka air quality is around 300. So what is the air quality in Bonn? I'm sure it is less than 100. So if you just think about, this is a huge inequality. It is a systematic discriminations from the city to cities, the country to countries. So this need to be addressed, that every people of the planet are equal rights. Every people need to the justice. And not only the people, the all creatures of the nature need justice. A bird lives in the small village in Bangladesh, has equal right a bird lives in a small village in Germany. So if we can see that the situation, but in the village in Bangladesh, the birds don't have the proper habitat. They lost their habitat, they lost their food chain because the huge and excessive use of toxic pesticide and fertilizer. So these are the common differences, discriminations, exposure, lack of access. And another issue is the access of information. So that also the important task to address. Nobody knows what happened in the first world and what happened in the second world. So we can just differentiate with the number. This is the first world and this is the second world. But people doesn't know what is the first world called and what is the first world mean. And so this kind of discrimination we have to address. This is not just for the pollution by the chemicals, it is need to be addressed by the policy. So the chemical issue is an integral issue of the policy issue. So that is why we are talking about the global framework of chemicals. So in that sense, our issue is environment versus health, health versus environment. The huge disruption of the direct exposure to the health, it is coming from the water, air, food, and the contaminated soil. So if these three major parts of the environment are polluted, so how people could survive? And this pollution is definitely coming from the chemical exposure, the heavily chemical exposure, and different ways we use the product every day. And I'm just happy to share with you a very recent information by our organization has done a study on hand wash and toothpaste. These two products are very essential product for every day. And these two products, we find that high concentration of toxic materials. So just 2 days ago, this report released, and it's a huge issue at the moment in Bangladesh, that we found the heavy toxic materials in the toothpaste and hand wash. And even in the children toothpaste is a high exposure of the chemicals. So that means that we are not justified the rights of the use of clean and safer materials that we are everyday using. Nobody can pass their days without toothpaste or hand wash. So just think about that. This is the consideration that this is an inequality, this is an injustice to the society, to the people, and people doesn't know about that what will be the harm for that. Simple issues as that we know the fluoride use is long back, but the science, the study says the excessive use of fluoride can cause harm for your teeth. So nobody's caring about that in the third world countries. Everybody's, even the big in the advertisement, they says this paste has salt, but nobody knows the excessive use of salt is harmful for the body, human body. But they are giving ad that this toothpaste is salt, so you can use it. So these are totally injustice, totally unacceptable. So in that sense, that we have to not only the environment, not only the human health, if we can see the whole ecosystem is disrupting. So that, and then impact to the climate. And everybody, we are talking about the climate change, we are talking about the other issue, health issues, environmental issues. Now the days is coming for the plastic. So the plastic is contained more than 13,000 chemicals. So the plastic product from the processing to the product is used 13,000, and UNEP identified more than 3,000 are totally toxic in nature and harmful. So this is the issue, that chemicals in everywhere, chemicals in our everyday commodities. So how we can deal it? This is the issue that we can address. So the health impact, environmental impact, the pathway, technology advancement. In the name of the technology advancement, there is a lot of chemicals are introducing. We are in the SciComm framework, in the ICCM global framework for chemicals, and you know that the Rotterdam Convention also identified a lot of chemicals. But the issue is that who cares that? Who to be accountable in this issue? Who to be address this issue properly? So we know that we can say that this is a health impact, this is an environmental impact, this is the source of pathway of chemicals. So everything that we can address, but we need to address how we can deal this chemical, how we can protect our citizen and future generation, as well as our ecosystem from the harm of the chemical pollution. This is the issue that we have to address at the moment. So the research strategy, we have to find the gaps, we have to address the need, the knowledge transmission is very important. I mentioned earlier that information sharing, knowledge sharing, technology transfer is an important part to deal with this issue. And this issue is not for just for developing countries issue. This issue not for the developed countries issue. This issue is a global issue. And so we have to address this in the global forum and act in the national level. We need more national legislation, more national commitment, more national legal framework. And not only the framework, we need to enforcement of the framework and legal bindings. We know that the most of the chemical regulations and legal frameworks are voluntary approach. These are one of the barrier to protect and go for the proper management of the chemicals. So if we are not thinking about some mandatory approach, it is difficult to move forward. So this nowadays, we have to think about how something mandatory approach can be enacted, can be proceed, and can be adopted.
All right, Mr. Hussein.
Yes.
Sorry to interrupt you. I just wanted to make sure that we have some time left for the discussion, but I think it's your last slide, right?
Yes, this is my last slide. I'm just wrap up finally. That is, I'm sorry for that. This is already discussed about the global framework. I'm not going for the deeper on that. This is the issue of management. This is source mobilization, resource mobilization, cooperation. My final comments is that we have to think about these issues and coming together to protect our generation, protect our environment and nature from the chemical pollution. Thank you very much.
Thank you so much for your super important input, Mr. Hussein, and sorry for interrupting.
No,
I hope we can follow up on that topic a bit later if we have some time left. And if you have already any questions for Mr. Hussein, please feel free to use the chat function. But now let's jump right into our last short input for today, for which I would like to introduce Kim Pak to you. She is trained in biology and toxicology and started working with the German Environment Agency in 2016. And she worked as a project manager for the HBM4EU initiative, which she will provide an overview in the upcoming minutes. And so I'm very happy to give the floor to you, Mrs. Pak.
Thank you. Okay, I'm waiting for my slides. All right, there they are. Yeah, as I was already told, I will give you a brief overview of HBM4EU, the European Human Biomonitoring Initiative, and our motto was Science and Policy for a Healthy Future. So I think this fits quite nicely in today. Next slide, please. I will give you a first view over HBM4EU in general. So the initiative originally ran for 5 years, was then extended due to the pandemic for half a year. So it ran from 2017 to 2022, and it was funded under Horizon 2020, the European Commission's framework program, as a European joint program with a total budget of 74 million euros, of which 70% was funded by the European Commission. 30 countries, predominantly European ones, as well as the European Environment Agency, participated with 120 partner organizations in total, roundabout. During the project runtime, the whole effort was coordinated by the German Environment Agency. And what HBM4U did was answer open policy relevant questions as defined by EU services and partner countries, and it gave policymakers a fast and easy access to results and data. This was a worldwide unique approach, and why that was, please, next slide. We can see here in that and there was a prioritization exercise already before the project started. 9 substances and substance groups were prioritized here, and this was with the input of national and EU agencies and ministries. So we really had the policy connection here. Later on, inside of the project, we also had the ministries and EU agencies in the highest decision-making body of the program. So we started out with these prioritized substances. There were so-called policy questions, formulated questions to answer the most urgent questions about this, about these substances and substance groups. Next slide, please. And then during the project runtime, there was a second round of prioritization, and more substances and substance groups were prioritized and also fed into the work program. So these policy questions that were created were basically the baseline of our work program that was set up to determine body burden, study effects, and further develop sustainable risk assessment. All right, so this already sounds like a lot of stuff, and we have a lot of results. I cannot show you all of them now, but I will give you a few highlights. Next slide, please. Yeah, we see here the pesticides, first and foremost, that they are known to be toxic for the nervous system, and the HBM4U data shows that the decision not to renew the chlorpyrifos authorization in 2020 was spot on, because there's still exposure levels in the populace, especially in children, and this proves basically that this decision was right. Then we have arsenic. Arsenic is known to be reprotoxic, and up to 40% of adolescents exceed a value that shows cause for concern. Then we have the bisphenol S. Bisphenols are known endocrine disruptors. And we have an HBM guidance value here that is exceeded in 11% of participating adults. And the HBM guidance value is a toxicologically derived value that above which, or rather it marks the level above which we cannot say with sufficient certainty anymore that a health effect related to exposure will not happen. So this is also cause for concern. We have also here cadmium. Cadmium is nephrotoxic and known usually to be connected to smoking status. But here the colleagues that worked in the initiative found that cadmium is also associated with vegetarian diet, apparently. 35% higher levels have been observed in vegetarians than in non-vegetarians. The PFAS, the forever chemicals, toxic for development and immune system of children in the womb. 14% of participating adolescents exceed the guidance value for the sum value as defined by EFSA. So also rather concerning if you look at that. And then lastly, the PAHs, polycyclic aromatic hydrocarbons. Here we see that excessive lifetime cancer risk is increased in 4 of 7 studied countries. So this is really quick overview. You are invited to read into our special issue, which I listed here, and also have a look at our project website. Even though the project is over, you can still, these resources are still available and will be for quite some time. Next slide, please. My last example from the results would be that here from the HBM4U Align studies, this is basically all the studies that were brought together, were already existing or had data and or were newly set up, that were brought together. The data was harmonized, put together, and here we see in the regulated reprotoxic phthalates and the substitute DINCH in the age group of children. In the graphic on the on the left-hand side, you see the countries that were looked at, and then also on the lower side, the phthalates that were looked at, and the pink boxes basically mark where the HBM guidance value is exceeded, so where we cannot say with sufficient certainty that a health effect is excluded. So in conclusion, we can say that people in Europe are still so highly exposed that they are not safe from health impacts that may be caused by chemical exposure. Next slide, please. We also concluded from the initiative as a whole that national HBM programs aid policymaking and communication on national level, and that is very important. But the EU is tasked with chemicals regulation, which is why we concluded that a continuous HBM on EU level is necessary. Next slide, please. Yeah, HBM4U may be over, but the flame is passed on, so to say. HBM4U managed to pave the way for the partnership for the assessment of risk from chemicals, and the follow-up to HBM4U is located in the work package for exposition and monitoring, and PARC will focus on human biomonitoring, but also on environmental monitoring. That's it for my small input, and thank you very much for your attention.
Thank you so much, Mrs. Pak, for the great and informative introduction to the HBM4EU initiative. And at this point, I will hand over to my colleague Dorothea, who's going to moderate the further conversation.
Great. All right. Thank you so much, Anka, and thank you so much to the speakers for these really, really interesting inputs. A lot of facts there, and I'm glad that we also already have a few questions in the chat. Please keep them coming, and if you have them directed at somebody in particular, then do mark that. Maybe we'll start with a question that just came to Mrs. Pak, and I'm sure when we saw the presentation, we were also like, what's going on with the vegetarian diets and cadmium here? So Mrs. Pak, maybe you can enlighten what's going on there.
Yeah, so I have obviously I'm not the head scientist who came up with this and who wrote the paper. I will gladly link this paper in the chat and that you can have a look at. But from what I saw and understood from the colleagues who performed this research, this may have to do with certain fertilizers being used, and then people eat the crops that are fertilized with this, and therefore the yeah, this is at least the theory as far as I know. So I'll link it now in the chat, and you can have a closer look. I will also link the what's it called? Sorry, the special issue as a whole, so you can have a look at all the other publications as well if you're interested. So the first link is directs to the paper about the cadmium exposure, and then the second one to the special issue I mentioned.
Great, thank you so much. I hope that answers the question. I'm sure lots of people will click on that link now. We'll come to a second question, which Antonia Reilen was posting earlier. And she asked if there's a link between the global framework for chemicals and the Science Policy Panel on Chemicals and Waste and the Plastics Treaty. Mrs. Emig, maybe you are able to answer that question?
Yeah.
Yeah.
I can at least start. I'm not very familiar with the plastic treaty, but I'm of course familiar with the SPP negotiations. And just to mention that the conversation started within the intersessional process on CICHEM. We all were convinced that a panel like IPCC or like IPBES would be very helpful to collect scientific data, to also evaluate scientific data, assess, and what is I think an important criterion by IPCC so successful, they're also communicating in language that is understandable by each and everyone and not only by experts. I think that was the reason why we were pushing also from the presidency side, ICCM5 presidency side, to start the discussion or to discuss the possible science policy panel under the intersessional process. It has been taken up, what has been developed there, it has been taken up by UNEA and is now further developed within this subsidiary body, open-ended working group that has been set up to negotiate this science policy panel. So it is clearly linked, and I expect also future links. So I mean, we do have several targets, and we would like to get advice to those targets from the science. And maybe not only advice from the toxicology or ecotoxicology perspective, but also from the perspective like economy. What are solutions that are, on one hand, sustainable with respect to ecological or human health aspects, but as long as they are not also attractive for people to take them up because they're too expensive, then this will be very difficult to be regarded as a sustainable solution. And therefore, we expect the a new panel, as soon as it can take up its work, to also give advice to the global framework, as well as on overarching questions to all the resolutions and to also regulations within the labor or pure health area. So hopefully what we achieve is a science policy panel that has the authority to advise on all aspects related to chemicals and waste in order to prevent pollution and to benefit from the upsides of chemicals in a sustainable way.
Great. Thank you so much for explaining that. We have another question, which is quite a practical one, and maybe also illustrates how difficult it is sometimes to avoid certain chemicals because they're so omnipresent. This is a question about PFAS. In many parts of France, we are now receiving alerts on the contamination of tap water with PFAS and pesticide residues. The local health agencies are not willing to provide more details. What advice can you give pediatricians and give to our vulnerable patients, given that bottled water is not sustainable and also highly contaminated with nanoplastics? I don't know if anyone can answer that specific question, or maybe at least a part of that.
I can maybe provide a small, or rather an infographic that we developed in the project HBM4U. Again, I will answer to the question directly in the chat and maybe link to this so you can have a look at it. And there are some recommendations on it. However, I really hope that the local authorities will soon give any sort of advice on how to act with that, because that is, I think that's the thing that is in their authority to it's a bit shocking to hear that people that the authorities are not reacting. So I really hope that is that will soon be remedied. But I will try to reply here and post the link.
Great, thank you so much. Maybe it's also an example of where the health sector and its attention to these issues can play a role by just showing that they're interested, that it's an issue for the health sector, because I think quite often it's still seen quite separate, isn't it? So good information is also good patient care. There's another question for you, Kim. I have the impression that in spite of the very important studies, the EU does not really react on that, and it might get
worse, I think.
All of the EU politics shifts to the right. What can we do for more pressure? So in light of the upcoming EU elections, I suppose? Well, how can we keep up better regulation?
Well, I'm no politician, but I can just say from my experience that the EU, everyone that was working with us from the EU services, they were very interested in this topic. And I think since we have HPM, there's a whole row, I didn't have the time to show this today, but there was a whole row of actions that the EU took in with regards to human biomonitoring and to strengthen it and the cooperation in all of Europe, and also with like we had international not partners, but we had experts who were sitting in our advisory board from international HBM studies. So I think we can see that after HBM4U, the next initiative has already been started, and it has an even larger budget as far as I know. And I think the EU is interested in this. I cannot answer the question how we could put more pressure, because I see that the EU appears to be interested in the topic in itself already.
Mm-hmm. And I guess there are quite a few policy developments underway, or at least planned for the next legislative period in the EU. So yeah, I think we can all say that it's not like nothing's happening, but of course it's very complex issues that we're dealing with. There was one more comment about cadmium and the vegetarian diets, a few suggestions there that it could be due to certain products being consumed more by vegetarians, but maybe there's more detail of that in the study that you posted. Yes, so if you have any more questions, please do put them in the chat. Maybe in the meantime, Dr. Hussein, I can go to you for one question that I had. You talked a lot about the justice implications, and I'm wondering, what do you see, like how can you inform people more about what is going on and really bridge this gap between what you were talking about, the impacts that are there, and what people actually know? And there's actually now a question for you as well. Which stakeholders need to do what in order to reduce chemical pollution in all countries, including developing countries? Is there anything needed beyond legislation that European countries could do?
Yeah, actually, this is, I mentioned that information sharing is very important. So information, if the information accessible, then people could educate how they are using the chemicals and what type of chemicals. And from the third world country, like Bangladesh and other countries, we have the huge accessibility problem. So like PFOS, nobody knows about PFOS. What is this? So, and this kind of things need to be open source of information. And you definitely have the role to help Bangladesh to as a catalyst to share the information, that what is happening and what will be happening and how we could deal this issue, the chemicals. And I mentioned that the justice issue lies with the information accessibility. If people doesn't have the information, how they could react, how they know the situation. So information is crucial to educate the people. Information is crucial to raise the public voice.
Great, thank you. Yes, I think that's very powerful. And there was another comment for you there. Again, sort of what can we do in the EU, I suppose in this international context, maybe some of that, what you both, you and Dr. Emig talked about in terms of the international framework, I guess that's there to help that, but obviously a lot more can be done. I don't know if Dr. Emig, you have some thoughts on that as well in terms of the view to developing countries who were very present at the International Chemicals Conference, but maybe you want to say a bit more on that.
I try to. I try to. I mean, for me, first of all, I very much share the view of Dr. Singh that unsound chemical management or poor chemicals management contributes to injustice, to inequality. That's for sure. I think that has been addressed a little bit in the framework as such, also through the gender topic, because I think that's an important part of justice. But what I wanted also to say is a completely different thing. Our observation was that there are very few people understanding that chemicals affect them all, and that chemicals is really a part of our life. So I think it was quite hard to also convince politicians to dedicate commitment, resources to this topic. And this is why we were of the opinion that first, a science policy panel would be important, and second, that we need to use language that is understandable by all. We need to avoid the expert language that is very often seen in all those regulations, be it on a EU level, but also in the international level. So I think from that perspective, the Bonn Declaration is quite important. Of course, if we do not follow up on this, nothing will happen. And as one of the co-chairs said after the ICCM ended, she said, when we leave Bonn, our work starts. And that's unfortunately true. So we need to follow up. But I really think to convince politicians it is very, very important to, of course, based on information that we can share and we should share. We use language that each and everyone understands. The topic is complex, which is also not very helpful in this regard. And the cross-cutting nature, which was already mentioned before, I think that makes it even more difficult. But people need to understand it is cross-cutting, it is affecting our daily lives. The global planetary crises are interrelated. They need to be addressed in a coordinated manner. And this hopefully will also help us to raise the financial resources that are necessary. And then finally, one point. I mean, it's not rocket science. We know for many things, we know how to deal with it. And classification and labeling is a first step. If we know about the properties of a substance, if the properties are labeled, that's the first step to then follow up and to also contribute to justice in a way.
Yeah, that makes sense. Thank you so much. And I think hopefully we could make a little bit of a contribution to that today by really raising this topic in our with our audience, many of whom are from the health sector and maybe are not so familiar with this topic yet, but maybe see the importance. I can also really recommend some of the fact sheets from the HBM4EU study, because it really says in very plain language what they found, what impacts it can have on health, what the evidence is. I think that was very helpful also for us to understand why this is an important topic for us in the planetary health context. I'm afraid we have run out of time. I just wanted to mention a couple of things. One is that this is the first of two planetary health dialogues that we have on chemical pollution. And indeed, the next time we want to look more at the European level and what has been happening on the European policy context, this legislative period that is coming to an end now, and also what should happen in the next one. You will receive an email with an invitation to that. It will be mid-March. The exact date will be confirmed shortly. Anka already said a video recording of this session will be made available on our website very shortly. And with that, I just wanted to thank you all for coming, for diving into this really, really interesting and rich topic with us. And I hope you can also join me in thanking our excellent speakers for their contributions today, for their participation in the discussion. I think we all learned a lot today. I can certainly say that for myself. And with that, have a very good evening.